Carbapenems are another type of semi-synthetic beta-lactam antibiotics. That means their structure also contains a beta-lactam ring. The mechanism of action is the same as other beta-lactam antibiotics, that is, they inhibit the cell wall synthesis and that makes them bactericidal in nature. They are also resistant to beta-lactamases. Their structure contains a beta-lactam ring, as you can see. They have a wide range of antibacterial activity, including gram-positive organisms like streptococci, staphylococci, enterococci, etc., and also gram-negative organisms like Pseudomonas aeruginosa, Enterobacteriaceae, and Bacteroides fragilis, that is an anaerobe. And it is not active against MRSA. Spectrum of antibacterial activity, they can be used as an empirical treatment, that means before we are sure what sort of bacteria we are dealing with, we can use carbapenems. Some of these drugs include imipenem, meropenem, doripenem, ertapenem, and ferropenem. We'll only discuss the first two, that is imipenem and meropenem, because these two are important. Imipenem is most potent of all the beta-lactam antibiotics. Now this is a point to remember. Whenever we administer imipenem, we don't give it alone. We give it with celastatin, that is a dehydropeptidase inhibitor. Now, the purpose of using both of these at the same time, not in one preparation but in the same IV line, what this does is, first it inhibits its metabolism and thus increases its half-life. Also, after its metabolism, imipenem is converted into a nephrotoxic metabolite and thus its production is prevented. And also it can increase the concentration of the non-metabolized drug in the urinary tract and thus can be used to treat the infections that are associated with the urinary tract. The side effects can include cross-reactivity with penicillins and cephalosporins, and also 1 out of 2 patients can experience seizures. GI distress is also seen, and as I said, it is nephrotoxic as well. For meropenem and doripenem, you don't need to give celastatin with them, and the risk for seizures is also lower than imipenem, and they can be used when the Pseudomonas aeruginosa is resistant to imipenem. Lastly, ertapenem has a long half-life. That's all.